Welcome everyone this afternoon to our program called Mental Health, Start the Conversation. This is part of our community conversation series that we're having up until the end of the year, every month, except for the summer. So my name is Jennifer, and I will be the moderator / panelist, co-panelist for today. So today's program will be recorded and uploaded to the library's YouTube channel at a later date. So during the presentation, please turn your cameras off and have your mics muted to mitigate any background noise, but there will be an opportunity at the end of the session for some Q&A. If you have any questions during the presentation, please put them into the chat and I'll feed them up to the facilitator. First, I would like to start off with a land acknowledgement. So I'd like to acknowledge that Oakville Public Library is situated on the Treaty Number 14 and Treaty Number 22 treaty lands and territory of the Mississaugas of the Credit First Nation and the traditional territory of the Huron-Wendat and the Haudenosaunee. Oakville is currently home to many different First Nations, Inuit, and Métis peoples. Regardless of where we come from, we're all interconnected through the land that we live on, air that we breathe, and water that we use. We are committed to a continuous learning journey in allyship, and we seek to elevate Indigenous voices and lived experience and to cultivate reconciliation in Oakville. So next, I would like to introduce the speaker for this afternoon, or co-speaker for this afternoon, Maneet. She is a passionate community change maker with over 8 years of experience of mental health nursing experience. She co-founded Soch Mental Health with her best friend Jasmeet Chagger in April of 2015. Soch Mental Health is a South Asian mental health initiative aimed at providing culturally and linguistically appropriate mental health promotion for the South Asian community. So welcome to Maneet. I will just stop sharing my screen and you can carry on, introduce more of yourself.
Thank you, Jennifer. Welcome, everyone. Thank you for taking the time on a Monday afternoon to join in on a brief and hopeful, insightful discussion on mental health. So usually myself and Jasmeet, in all the community work that we do, in the meetings that we hold, we think it's really important to always start off with some mindfulness and just bringing ourselves into the present moment. So I'm going to guide you, if you will allow me to, into a brief mindfulness activity, just some breathing so we can really orient ourselves to the discussion that we're going to have today, and really hoping that we can use the little bit of time we have this afternoon to engage with one another, if there's any questions or concerns, I can answer them, and that we can, collectively work to improving our mental health as a community. So to get started, I'm going to invite you to sit in your seat. If you are sitting on a sofa, cross your legs. If your feet are on the floor, plant both feet on the ground. You would want to sit with your spine elongated. So try to sit up nice and tall. Relax your shoulders. You can place your hands in your lap and just focus on your breathing. Try to be intentional with your breathing. If you want to slow it down, I invite you to do that. You can breathe in through your nose, hold for a few seconds, and exhale either through your nose or mouth, whichever you prefer. Just take a moment to practice some gratitude. Anything in your life in this moment that you are grateful for. Send some positive vibrations. Send a thank you. If it's your family, your friends, your job, the weather, a meal that you had today, a moment on the weekend. Any small thing, practicing gratitude can be a great way to elevate our vibration and kind of shift our perspective to look at things and appreciate what we have rather than what we may not have. With that thought of gratitude, put a smile on your face. You can open your eyes and come back. And know that anytime you wish, you can always go to your breath. You can always practice gratitude. It can be a quick way to shift our perspective and look at things, like I mentioned, in a different way. Great way to start your morning. If you're not a morning person, you don't need to do this early in the mornings. It can be on your lunch break. It can be after work, in the evenings, any moment that you have to yourself. So I really encourage you to add this into your daily practice and to see how it improves your mental health. So we are going to get started with today's session, which is, as Jennifer mentioned, she's a co-panelist. So we were trying to figure out how we could best have an engaging conversation with the community that joins on talking about mental health and starting the conversation. So we actually came up with a series of questions. Jennifer and myself are kind of going to go back and forth with sharing this information, adding a bit of our experiences, and myself adding in some knowledge. And when and if you do have questions, please feel free to use the chat. And, this session is being recorded. So maybe being mindful about not disclosing any personal health information of yourself or a loved one, but maybe keeping a general sense in terms of discussion questions. And I'd be more than happy to add my insights. So Jennifer, if you wanted to get started with maybe our first panel question, and we can kind of move along with the panel that way.
Sure, absolutely. So the first question harks back to the title of the presentation is starting the conversation about mental health. And how do we start a conversation about mental health? How do we open up and discuss our mental health issues, or even realize that we're having them? So that's very important. It's actually just starting the journey. Towards mental health.
Yeah, no, that's a really great question. And I think a very important one, with mental health, and even myself, I guess I didn't completely update my bio. It's been almost 10 years that I've been working in the field, but kind of looking at mental health within my home before I actually became a mental health nurse. My dad struggled with depression, and growing up and seeing that, especially being part of an ethnic community. So my background is I'm South Asian. I come from a South Asian Punjabi household, and talking about your emotions, talking about being vulnerable, talking about, any concern that talking about something that you're not okay is not easy, and it doesn't come easy in a lot of households. So I think in terms of when we're thinking about, how do we even have a conversation in a place that in a community or a culture that doesn't welcome that, can be very uncomfortable, and it can be very difficult. So I think one of the things that I've kind of learned over the years, I think part of it's my clinical practice, but I think a lot of it has to do with my human experience and just being in connection with other people. I truly believe in transparency. And I think that's one thing that isn't really encouraged openly in the healthcare field. We have this idea as a mental health professional or a healthcare professional, I have to maintain my professionalism. And in being professional, I can't share certain things, or have to keep that barrier. But I really feel that the reason why Soch, the mental health organization I co-founded with Jasmeet, why we're able to do what we're doing well in terms of breaking the stigma about mental health in our community, is transparency and being appropriate with transparency. And I think that goes across the board, not just for professionals, but just in the community. So when you want to start a conversation about mental health, I think to start a conversation and to really get an honest answer from the person you're talking to and from someone across the table, I think you have to be willing to be transparent, and in being transparent, you build trust. So there are times that, I've worked with individuals, I've supported them, and I may have shared, if let's say they're going through grief and suffering, I may have shared, I've actually experienced a very close loss in my life. And that time was very dark and very challenging for me. And I, sometimes still struggle with that. So did you want to share a little bit about how you're feeling? I think that makes yourself relatable to the other person. I think it's completely impossible to start a conversation about mental health and not show your own vulnerability, because how do you expect someone else to be vulnerable and share the darkest, deepest parts of themselves, the parts that they feel guilt about, they feel shame about, because they're maybe shamed in their community, they're shamed in their families. So I think that makes it very, very challenging. That's one part of how to start a conversation. And I think the other element of humanness and how to start a conversation is don't shy away from the culture and the language, which is very, very key. So like even myself being a mental health nurse working in the region of Peel, I worked with different ethnic minorities, and I can see a huge shift in the dialogue and conversation when culture is language is involved, as opposed to when it's not. So I can, I remember this example. One of my clients, she was South Asian, she spoke Punjabi. I speak Punjabi as well. She wasn't doing well. She came in to see the psychiatrist, and I had mentioned that her appointment should be when I'm at the office. So the psychiatrist was running ahead of schedule, took her in before I was actually there. Luckily, I had just made it, but she was walking out. It was a less than 5-minute visit. And he's like, oh, she's doing great. I'm like, no, she's actually not. And I actually joined in on that appointment, which ended up being like a half an hour to 45-minute assessment. So I think in starting a conversation about mental health, being transparent, considering culture and language is very important. And I think that goes across the board, right? You can have a conversation about mental health with a 4-year-old and a 90-year-old, and not to think that a 4-year-old doesn't have mental health and a 90-year-old doesn't have mental health. We need to kind of be mindful of the conversation and how we approach it. So the word Soch, S-O-C-H, which is the name of our organization, in Hindi, Urdu, and Punjabi, it means to think or a thought. And so when you think about your thoughts and you think about the way you think, you may not necessarily think about mental health, but this word has captured our community in such a way that if I go to an elderly person in my community and say, I'm a mental health nurse and I work to help your soch, the way you think and the way your thoughts are, they get it. So it's not that some places, like, sometimes we say, certain cultures don't have the language, they don't have the words for mental health. They may not have the exact word for like schizophrenia or like, bipolar, but they have the language and description to describe it. So I think that kind of goes into how I might start a conversation or what to consider. Is there anything, I guess, from what I'm saying, Jennifer, are you having any thoughts? Like, I guess I'm coming from that professional lens. Is there anything that I said that resonated with yourself about how we should start talking about mental health in our communities and our families?
I resonate a lot with what you're saying about it's never talked about. Like when I was younger, we never had any mental health resources such as we have today. I'm 45 years old, so we never had anything like this. It wasn't talked about, it wasn't discussed, or it wasn't so much in our sphere of consciousness now that
Right.
it's much easier, but also I find it much harder because there's so many resources, so many agencies, so much, you kind of don't know where to start. And just starting the conversation is also, sometimes starting the conversation is difficult because you don't know what the problem is sometimes
Yeah.
in the beginning, in the start. So you don't know how
Yeah.
to explain how you're feeling. You're just feeling depressed or low or no energy. And so you don't realize how to start the conversation because you don't know what it looks like.
Yeah, I resonated with two things you said. The first thing, that it wasn't in the sphere of consciousness. So in my home and my families, I hear this quite a bit about, my mom will be like, oh, we never used to have this stuff when we were growing up. It never existed in India, for instance, because my parents both immigrated from India. And I found that very interesting. It's not that mental health didn't exist then, it just wasn't talked about, right? Or it was not talked about as much as it is now. But even now, it's still not talked about as much as it should be talked about, right? Like that's kind of one thing. And then, I guess in terms of not knowing how to have that conversation as the individual who's struggling. And I hear this quite a lot from people, like, maybe they'll reach out and they've contemplated maybe reaching out to a professional for support, but they're like, it's not that bad yet. Or if I go to a therapist or I go to a doctor, what do I say? Because like you mentioned, like I'm feeling bits and pieces of this, but I'm maybe internally in my mind comparing it to how bad it should be. And so that's the other thing, like you mentioned, honestly, it's like you don't know where to start, you don't know how to start, but you just have to start putting words and spilling something out, because the person sitting across from you is trained, knows this field, knows that you and I could be going through maybe the same mental health concern as an illness, let's say depression or anxiety, but both our narrative is going to be very different. So as a professional, I know what to ask you. You could start the conversation anywhere, which you probably are like, I don't even know if this is a starting point. When did this start? Like, am I even going through something? But I think the point is to just start anywhere and start somewhere and talk to a trusted person. I think that's my biggest thing, right? Like not every concern necessarily means going to the hospital or going to the family doctor or going to counseling. We all have mental health. It's on a spectrum. So there's going to be times you're struggling with something and you talk to one of your best friends, you talk to a colleague at work, and maybe you talk to someone who maybe gave you that window of opening. And that's why I was saying that transparency. I try to be really transparent with people, right? And I think sometimes it catches them off guard. Like they'll be like, hey, how are you doing? And I'm like, I'm not having a good day. And I think that really surprises people that I'm actually saying I'm not having a good day, as opposed to being like, oh yeah, great, thanks. Like that's superficial thing, right? And I still remember like the different workplaces I've been at, those hallway conversations, someone walking by, hey, Maneet, how's it going? I'm like, not so great. And it actually catches them by surprise. Like, whoa, like she's actually sharing, she's not doing okay. And I think that that's the type of transparency I'm talking about, right? I know it's not always appropriate depending on the social setting you're in, but we need to stop putting a filter and covering up, because I think that takes a lot more effort. It delays you getting the support you may need. And the support might be a good friend, right? Like someone helping you problem solve, someone bouncing your ideas back off at you. So that might be a different way to go about it. But I really appreciate your perspective to it, because I think as an everyday person, when you're going through it, you're like, it wasn't in my realm of consciousness. We weren't talking about it. When you talk about it, where do you start? Because that's a lot of stigma people have as well. They don't want to go to a professional because they're like, it's not bad enough, I don't know where to start, or this doesn't make sense, right? So you continue to struggle on your own until you're forced into getting help.
Yeah, you don't want it to let it get bad enough that you think of harming yourself, or it's a balance. I think it's hard to, it's just have to start. I think with anything you just have to start, and then it'll come, like it'll just start the conversation.
Yeah.
So do we want to go to our next question? Was, as well as we were talking about the different resources that are out there, the other question is, how do we take the step to using the different resources, or finding them, or even making that first phone call or email, or
Yeah. I think if we can switch the order, I'm kind of looking at it right now, because like I know we're going to talk about resources. Maybe if we can talk about that at the end, like how do we take the step, and then we'll talk about the resources. But I think the next question may be more in line with like, how do we start the mental health conversation? And then if we're having signs.
How do you realize that you're struggling, or the signs that you're struggling?
Yeah, I think just in terms of order, that actually makes a lot more sense. But yeah, like how do we recognize the signs that we're struggling? So I think this is really interesting, because like, you could be someone who's so busy and so good at keeping busy that you don't make space or the time to recognize you're struggling. And we find this pattern in a lot of people, that they have a tendency to, just be busy in their day in, day out. They're busy in, let's say, socializing after work. So there isn't that quiet time to actually recognize something's wrong. And so I think the pandemic is a really great example of where we may have had certain distractions that kept us from facing our struggles, our internal struggles of, whatever those struggles were, and those coming to the surface because now we couldn't run away. So recognizing some signs, my first thing is in order to recognize that you're not okay, or for a loved one to recognize they're not okay, they need to make space to kind of do a check-in, like, how are things going? Like, how am I doing? And if you really think about it, like, how often do people do this day in, day out, right? Like, if they maybe have a spiritual practice, or they practice mindfulness or meditation, or they have some sort of quiet time in their day or in their week, they can actually reflect. But most of us are so busy with our priorities or responsibilities. There's huge expectations on us from our family if we're in a caregiving role, that we don't necessarily see. But signs and symptoms of someone struggling is basically looking at someone's daily routine and seeing where are the changes. So you can go from sleep, right? Like, is your sleep off? Are you sleeping too much, too less? Are you getting tired during the day now, which never used to happen before because you're not well rested? Changes in your appetite, right? Like, are you not hungry anymore? Are you eating different types of food that you weren't craving before? Are you drinking a lot more coffee to function, or tea? And, like your changes in your appetite. Are there changes in your socialization? Are you someone who now is more reserved, more to yourself? Or are you over socializing because you're trying to compensate for the struggles and you're trying to fill a void? You can have issues with your cognition, so memory, making decisions, like decisions that used to make so quickly, or wasn't something that you really struggled with, you're now struggling with, right? You can also have more extreme symptoms and signs that you're struggling. For instance, having delusions, which is a fixed false belief, or having hallucinations. So you can have anything with the five senses, and hallucination doesn't necessarily mean you have a very severe, persistent mental illness. I've worked with patients before that have depression, but also are having hallucinations. They're hearing voices because they're not sleeping well. And so, and then the hormones and neurotransmitters in your brain are firing at different levels, and that's impacting your your senses, and you're having perceptual disturbances, as an example. The other thing to kind of pay attention to is your youth and children and elderly. So you can have a lot of physical symptoms. You're struggling, you're having a lot of aches and pains, you're having stomach issues. There's so much research now with mental health in your gut, and how your gut health reflects how your mental health is. And you can also have for instance, I've heard parents be like, my child's complaining of a stomach ache, like a tummy ache, and you're going to the doctor, getting tests, everything's fine, but then it turns out they're being bullied at school. So their anxiety is manifesting now physically. And you also see this a lot in different cultures as well, in ethnic communities, that we see it's called psychosomatic. So the mental health symptoms are actually in your body. It's a somatic experience, and they're having headaches and migraines, and you're doing all these tests and nothing's coming out as what's causing it, and it's related to mental health. Also with youth, you can have, trouble with the law, authority, defying authority, behavioral issues. So all in all, I think the biggest thing to kind of realize is that if you see someone struggling and they are acting out of their norm, what is normal to them, we all have a different routine. You and I, we may have completely different routines. When my routine is off, that is when my mental health is likely impacted. And that's probably a really good sign that things are not okay. I think a lot of times our family and friends probably pick up, our colleagues pick up that we're not okay. And I think, it's so important to pay attention to each other, right? Like sometimes we're so lost in our devices and we're not really paying attention. Our brain is in a million different places at once. And so, you know, when we're seeing family and friends, we're seeing coworkers, we're seeing people in the community, we should really be attentive and try to pick up if someone is struggling. I don't know if you have anything to add, Jennifer, based on anything I shared or any experiences you may have had. Or
I think us just coming from personal experience, if you just don't want to get up off the couch, or it takes you half a day to get dressed, or suddenly you start crying for no reason, or things like that, that you know that's happening, but you just kind of, and the tiredness too is
yeah, fatigue is a
being,
very big one.
yeah, it's just a lethargic, you know. I don't want to
Yeah.
get up and do anything, but I want to do everything. Like that's
Yeah. Yeah.
I
And I
don't
think
know.
like that, like I think with fatigue, right? Realizing that when you're having mental health symptoms, it's taking your body and your mind so much effort to cope with that and still try to maintain some sort of routine. And you were maybe struggling quite some time until some of those signs and symptoms became a lot obvious. So then you're trying to compensate and you're trying to make it seem like to everyone you're okay. So that's even taking even more effort, right? So I think to kind of appreciate where that fatigue and mental exhaustion, but even that want, like I'd love to do all this stuff, but I can't even get off the couch. Like, you know, like there's way too many steps. I think that really paints a really great picture of when someone's struggling, what that might look like.
Hmm. Absolutely. Yeah. It manifests itself in so many
Yes.
different ways. So I think we'll go back to the resources that are out there, because we realize that we're struggling. How do we find the resources, and how do we use them, and how do we find the right ones?
Yeah, so I'll probably just do share
Sure.
screen now because I think that will kind of go, and I think I was going to share resources at the end. But yeah, if you go on our Soch website, we actually have resources posted. And so like I kind of want to go over some of the resources and then kind of share like how do you pick what's right for you. So if you go to our Soch website, sochmentalhealth.com, and there's a section mental health resources. I think this diagram, it's actually in English and Punjabi because we do have a lot of South Asian Punjabi community members that access our resources. So those are the two languages that we currently serve. But when you are looking for a resource, what are the steps you take to getting help? I think it first starts off with, I think self-help is a very big one, where you want to do your own research and get information. And I think the idea here is we want to empower the community. If you are struggling, it's not always the professional that's going to know everything. Like I still remember when I started my nursing, my nursing practice as a student, my preceptor, the first thing she told me is like, ask the patient. The patient knows the most about themselves and what they're struggling with and how they may want to help themselves. So self-help is a really big one in terms of what are the steps you take to find resources, is do some research. Turning to your loved ones, right? Like people that you trust, family, friends, colleagues, teachers, neighbors, anyone in the community. Let's say you're part of a faith-based group. Turning to loved ones for support could be an excellent way of using resources. And sometimes we find, oh, that person struggled and this is where they went. And now we're getting that word of mouth kind of credibility and referral for a service. Your family doctor is actually the gateway for mental health resources and services. So, you know, you can make an appointment with your family doctor. It's very important for everyone to have a family doctor and have a family doctor that you like, right? I know a lot of people ending up with the family doctor that maybe their parents had or the family went to. So you can always find a new family doctor if the current one is, you know, not really aligned with how you might view mental health or health overall. So going to your family doctor, talking to them, there's community mental health agencies you can access. And even calling them, you can call an agency and say, there's a lot of places that do self-referral, or they'll tell you the process. So you can say, I'm struggling with depression. These are my struggles. What programming do you have? They might have some peer-based programming, community programming, or individual. There's a counselor. So if you want to look for a counselor, and the importance of counseling is like working with a one-to-one mental health expert who can help you with your specific struggles and symptoms and create a plan of support. And finally, the hospital. And I think the hospital is very specific in terms of if you have a mental health crisis and going to the hospitals. So on our Soch website, we actually have helplines. So, in terms of taking the steps to using resources, I think the first thing is to acknowledge that you're struggling and being open to help, and knowing that you're not going to be judged for asking for help. A lot of these places maintain your confidentiality, they maintain your privacy, so you don't have to worry about. And maybe a safe place to start is, instead of going to someone, is maybe calling someone on the phone. It seems to be a kind of less pressure on you, I guess. So there's some helplines here. We also have finding a therapist if you're looking to work with therapists. A lot of people through their workplace have employment coverages for health benefits that include counseling. You can also get in touch in that case with your employee assistance program. If you're a student, there's counselors at school. So elementary, middle, high school, universities all have mental health supports. We have mental health agencies listed for help. And then these are resources specific in region of Peel. But I wanted to share Halton specific resources, which the first one is Halton Mental Health. It's a Halton Mental Health resources, but there's actually a guide for Halton residents, and that breaks it down for resources for everyone, for children and youth, for young adults, for parents, older adults, caregivers, workplaces, and healthcare workers, which I found very neat. So if you were to just search Halton Mental Health Resources, the website is over here. It's nice to see resources broken down into each category. So, let's say you're like, I'm a parent and I need resources for my children. You have resources that are given to you. The second resource that I wanted to share was the mental health crisis team. So this is actually an outreach and support team. So if you are struggling with a mental health crisis, or someone in your family or some of your friends are, you can actually call this 24-hour crisis line, and it's available 7 days a week. They can provide you support on the phone, or they might do a visit as needed. And then I didn't have the Distress Center Halton on the Soch resource websites page. I just wanted to share that. But I think overall, in terms of how to take the step, like I mentioned with that diagram I showed, was kind of like, where do you want to start, right? Where do you feel like you should start? Are you at the point of self-help, something just starting off? You're still managing in your routine, you're still able to do things. You find some self-help resources and you talk to a loved one. Or are you at the point that this is now impacting your day in, day out, and that, maybe you need to talk to your family doctor, you need to come up with a plan and talk to a therapist? Or is it something that's getting very chronic? It's getting very difficult to manage. You're in need of a community mental health agency and or the hospital. So I think that is kind of like a guide, but I completely get that it's so hard to know where to go for help, because there's so many services, it's very complicated. So, if in any case you wanted to, for instance, call a mental health agency or even email Soch, we do provide support over email currently. So if someone sends us an email, hey, I'm struggling with this is where I'm from, we'll try to give them some direction on where they can turn to for support and what are some options for them.
That's good. That diagram makes sense to me about the steps that you need to take. It's not a one size fits all. It's
exactly,
you can pick and choose what's best for you.
Yeah, exactly. Yeah. Did you want to share the resources at the library, since we were sharing resources?
Sure. Let me share my screen. So I just wanted to share some books that we have in our collection. These are just random ones, but you can go to our catalog and do a search or ask any one of our staff at any of our seven branches. So these are from a curated list that our staff have done for mental health, for the month of May for mental health. So just some things: mind over mood, changing how you feel by changing the way that you think. Very timely mental health, it's time to talk. Cognitive behavioral therapy, and parenting children mental health challenges. Like we were saying, that children have mental health challenges, such as like all through the lifespan, everybody has mental health, need to take care of their mental health. And the other one is mental wellness. But if you want more resources, you can just call us up and ask. As well, we have a lot of different agencies as well, in addition to the one that Maneet talked about, that are available on our Halton Community Services directory that you can get through, that you can access for free through our library website, opl.ca. So you can always find the contact information there and what they cover, phone numbers, email, social media, all of that. So it's there as a resource if you need it. So I'll stop sharing. Should we continue on with, we're talking about the pandemic and how things have been sort of elevated or blown up, like issues that you had when, being in lockdown, it sort of exasperated the issues that you had, or the problems that you thought that weren't there, that you were trying to mask. So now we are starting to come out of that, and sort of the world has been kind of turned upside down in terms of the way that we communicate and the way that we interact with each other. And so the question is, how do we come back to the new type of normal, or how do we connect back with each other now that we're sort of starting to come out of it? That's a question that it sort of comes into my mind, of like, how do we want to communicate now, over video chat or in person, or so what are your thoughts on that?
Yeah, I think that's a great question. I think, the thing is that I think human tendency is to hold on to how things are always, like how things are and have always been. Change can be very difficult. So I think right now, a lot of concern, a lot of uneasiness comes from the idea that things used to be a certain way, like pre-pandemic, and now we are readjusting to a new normal. So are we going to go back to exactly how things were pre-pandemic? Or are we now trying to find a happy medium, a new normal? And I think you kind of want to shift to a new normal, because we have drastically, as human beings, as a collective community, we've drastically changed. Everything's changed, from workplace to schools to socializing to our entire culture. I think there are certain people that, are like excited and quickly want to adapt to how things used to be. And there are other individuals that are feeling a lot of anxiety and a lot of pressure and are feeling stuck. So I think it's really important to kind of assess as you go, and being open to the idea that you want to kind of shift to a new normal, and that may not exactly be how things were. Things have evolved, and trying to find out what's your comfort. It's going to be a lot of trial and error, figuring things out as you go. I know one of the big stressors right now for a lot of people is workplaces and going back into work, because now they have a certain lifestyle, a certain routine built around the last 2 years, 2+ years. So I think in that, it's really important to talk to, your colleagues at work, your management at work, try to figure out and voice what it is that you need, what your anxieties are, what your barriers are, and how can you also work towards readjusting to a new normal. Is there certain things, like maybe you're someone who didn't really communicate about what your expectations were, what your expectations are. So now you might need to voice what you need and what it is that you require. even with family and friends, right? And I think having a lot of these conversations, it's just been very exhausting for a lot of people. And we're kind of done with having to have that conversation again and trying to figure out like, I'm not comfortable with this, or I am comfortable with this. Or like, going into work now 5 days a week seems impossible because I've been working virtual for x amount of time. So trying to find a transition plan, I think with human behavior, we went from such an active life into complete lockdown. And if that is possible, it is completely possible to go from complete lockdown to having a bit more activity, but it's going to be a transition. So where can you kind of seek that support? Could there be a hybrid plan of certain things? And I kind of realized that as a mental health professional, right? Like, I was really excited that things are opening up and we can have in-person stuff, but also seeing a lot of people want to stay virtual. There's a lot of convenience with virtual, accessibility, transportation, time, flexibility, and the joy of, joining out from home from your pajamas. Like there's these benefits that we've also gained. So I think that's really an important thing to consider. And I think just an overall tip to be patient with yourself, be patient with others, and really be open to conversation and talk to people about what you're struggling with. And if you need further support, reach out for support, call a helpline, work with a therapist, maybe discuss with your family doctor if it's giving you a lot of anxiety. I think those are some options available to kind of how to readjust to a new normal, and not to hold on that everything has to be how it was. It has to go back to how 2019 was, that, you're going to be finding something that's a new level for you. And that's why, we kind of talked about readjusting to a new normal.
Absolutely. It's a transitional period for sure. I never knew anything about Zoom until I actually had to use it. Now I use it all the time, 3 or 4 times a day, because that we're connecting through.
Yeah.
But I find that my world has opened up so much more now that meetings and meetups are virtual, and you can basically meet up with anyone all over the world. So in that sense, it's good. But the working from home sometimes is difficult because you don't really have a set routine, or you don't always have that routine of getting up, getting dressed, getting in your car and going someplace. So that's been a bit difficult. I mean, the commute is shorter, so that's better. It's just go from my bedroom to my desk, but you kind of miss out on your social interactions with people. That's I'm finding. But we have to adjust to this new normal. I think it's going to take a while. It's going to take
that's what I mean. Like, be patient with yourself and others, right? It's going to take time to adjust, and it's a new normal. It's not what normal was. Things are always changing, and be open to that change and be open to what you're comfortable with, right? Like, find a happy medium. And if you are struggling, find the supports as you kind of go along. So I think in terms of, like the questions we covered with the panel, I just did want to lastly, one more time, share our like information for our website. So I'm right here, Maneet. This is Jasmeet. She's the other co-founder for Soch. We are very active on social media. We also have really great programming. We run a South Asian grief support group that is actually, we're going to be running another session. It's a 6-week program. But other than that, if anyone's looking for support, they can email us. We always have workshops, community conversations that are open to the community. So just want to thank you, Jennifer, for giving me the opportunity to come and speak and share information. And I hope this is helpful to anyone that listens and joins. And if anyone is seeking support, please do reach out, visit our website. There's resources there. And if you have further questions, you can send us an email at info@sochmentalhealth.com.
Thank you so much, Maneet. This was a wonderful panel. I really enjoyed talking with you about these issues and sort of, getting it out into the open and starting the conversation. And I really hope that people have joined, have learned something new about mental health, and they'll take the tools that we've given you, and you can use them in your everyday lives. So I just want to thank you again, Maneet. It was a wonderful experience talking to you, and I'm sure I will be checking out your website for for your different programs and resources. We had a few other programs happening for community conversations this month. So just check out our website at opl.ca, and the information is just right there on the front page. So some upcoming programs is Reading for Resiliency and Strength, how books help us to deal with our mental health. And also we're going to have at the end of the month peer mental health support with Natalie Harris, and that'll be a virtual program. So please check out our website for that. And I just want to thank everyone for coming, and have a great afternoon.